think I heard you say that the MMR vaccine for measles, mumps, and rubella is quite lethal. Is there any evidence of that? Because anyone in the room?
What I've heard is that there are some people that say it is that way. I've heard when you put them together, they can be explosive. Yeah.
President Trump making unfounded new claims about the measles, mumps, rubella vaccine after signing an executive order to split it up into separate shots for children as opposed to the current all-in-one vaccine. But the change directed from the Oval Office is already drawing backlash from the health community. The American Medical Association says it could weaken public confidence and put children's health at risk. For more on this, let me bring in physician and senior public health contributor for Forbes, Dr. Omer Awan. Doctor, it's always good to have you. I think parents everywhere, myself included, are watching this, wondering what the best, way to move forward is, hoping we do right by our children. The president calls this the gold standard of vaccine schedules. What's your take?
I respectfully disagree, Marquis. This executive order has no ground in science or evidence. The MMR vaccine, which is a vaccine that is one shot and protects against 3 different diseases, measles, mumps, and rubella, has been shown through decades of research to be safe and effective. So by splitting it up into 3 different shots does not make it any more safe or effective. And what this effectively does is this can create barriers for kids to get vaccinated, because what you're doing is you're now creating multiple visits to your doctor. So from 1 visit now becomes 3 visits, and that creates an opportunity for parents to potentially delay their appointment and potentially for kids to miss getting vaccinated. That's essentially what's going to happen. So this is particularly concerning, Marquis, because we're also in a measles resurgence. We've had more cases this year than we've had in over 3 decades. And the reason for that is because of declining vaccination rates. So I'm scared that this executive order will further decrease vaccination rates.
What do you say to parents, though, who say, I'm not going to forget to make each appointment if it were to be split up? Is your worry more tied to that parents will forget the appointment, or that this will sow doubt and confusion? Or is it about the efficacy of if you were to split up measles, mumps, and rubella in children?
Well, what I would say, Marquis, is that for some parents, it wouldn't be a big deal because some parents have the resources to go ahead and get the vaccine. But what about mothers who don't have paid leave? What about mothers who have barriers to transportation? They're going to miss these appointments, and that's going to drive down vaccination rates. Remember, we have to think about globally population level health. Some people are very well off, and that's great. But there are others that aren't, and they're going to suffer because of this executive order, and that's going to cause issues down the road.
And I totally understand that a lot of people don't have the time, the resources that others do, but should that be made an option to parents who say, I have the time, I'd like to split it up into 3, and if you don't have the time and resources, take it all in 1 shot. Should that be made available?
Well, what I would say, Marquis, is that options are good, and every parent deserves to have questions and answers about vaccines, and there should be significant transparency with respect to that. Every parent deserves that. Every child deserves that. But it's also about evidence, and it's also about, well, what does the science say? What has decades of research shown? And we haven't even studied, single vaccines. Those vaccines don't even exist in the market, first of all. So that's what's troubling about this.
President Trump also tying this decision to alleged links between vaccines and autism. And the American Academy of Pediatrics says the science around vaccines has not changed. You have Senator Bill Cassidy, who says the executive order is wrong and that state governments, not Washington, set vaccine requirements for kids in the United States. Is there reason to take another look at connections between autism and vaccines, you think, or no?
I don't believe there is. Decades of research has also shown that there is no causal link between vaccines and autism. And again, in science, we're always investigating topics, and there's no harm in asking questions in science, investigating them, and trying to figure out answers. And yes, autism rates have been increasing in America, and we do still need to figure out why that's the case. But vaccines is not going to be the answer to that question, because that has been tested extensively. Decades of research has again shown that there is no link. So I believe that this is sort of a settled debate at this point.
Dr. Omer Awan, a lot of eyes and a lot of buzz around this topic. Thank you for breaking it down with me. We'll see where it all heads next. Appreciate you, sir.
Thanks, Marquis.
Well, take